This committee will come to order. Tonight we will be having a presentation from Metro Social Services on the 2013 Community Needs Assessment. It's my pleasure to introduce to you the Executive Director of Metropolitan Social Services, Renee Pratt. Ms. Pratt, please introduce your guests.
Thank you, Councilman Harmon. To my left, I have Joyce Hillman, who's a social analyst for planning and coordination, Abdegani Barre, who's an analyst, Lee Stewart, who's an analyst as well, Donna Gregory, who is the program director of planning and coordination, and Julius Witherspoon, who's an analyst as well. Thank you so much for having us today. I'm just really excited about the release of our community needs evaluation. This evaluation has expanded sections in evidence-based practice and also in the poverty section. So we're really excited about the release today. As many of you know, Metro Social Services is governed by charter, and it describes several powers and duties, including making presentations to the Metro Council and other organizations. So we're glad that you're having us today. The needs evaluation also describes socio-economic, and demographic information related to Davidson County. And we retrieved this information from the U.S. Census Bureau, the U.S. Department of Labor Statistics, and other sources. So you'll be hearing quite a bit of information in a small amount of time today. So we hope that if you have any questions or if you would like additional information, please contact us. Our information is in the needs evaluation. I'd like to turn it over to Donna Gregory, who's our next presenter. Thank you.
Thank you, Ms. Pratt. I would like to set the stage about why this issue is important and how poverty has grown, and I can demonstrate that with a couple of maps. If you look at this map, you see the red section, which is poverty over 20%. Davidson County's poverty right now is 18.9%. The state's is about 17%, and the federal is about 15.9%. But this is 2000. Let us go forward to the most recent time measure, which was the period 2008 to 2012. The census now does it in 5-year summaries. So as we move forward from 2000 to the period 2008 through 2012, you see how poverty has grown. Again, the red is... Okay. Yeah. Again, the red is over 20%. And this is just a comparison of the two maps side by side. Not only is poverty growing geographically, it is getting worse. In 2000, the census tract with the highest poverty was about 44%. It's now around 80% for 2008 to 2012. As you can see, Nashville has two sides. We have a side that we see on the television show Nashville, which I love, and we also have a side that really, where not everybody has enough. They don't have enough food, they don't have adequate housing, they don't have what they need for their family. To tell you just a little about why we do the community needs evaluation, it is to help you know more about your constituents and service providers to know more about the people that need their services. It's available for policy makers, for anyone who needs to know who's in Nashville and what they need. Poverty is a huge issue, and the needs evaluation discusses not only the magnitude of it and the patterning of it, but the significance of it. It impairs many areas of a person's life, from education to health and numerous others. We have demographic and social data in there, several different kinds, age, race, ethnicity, family structure, a lot of other things. And just a couple of facts that you'll find in there, the median age in Davidson County is 33.9%, which is a little bit lower than the state, a little bit lower than the United States as a whole. But we have over 30,000 people who are over age 75 living in Davidson County. We have an unusually high percentage of people compared to the state and the United States, a high percentage of people who are living alone and people who have never been married. I don't know why, that's just the data. We have socioeconomic data, all sorts of data about income and poverty and so forth. The first map shows the per capita income in Davidson County by council districts. And I won't talk about this too much because it's on page 28 in your needs evaluation. And you'll see that anywhere yellow, red, or orange is below $25,000 per capita income. The average Davidson County per capita income is a little over $27,000. There are 23 districts that have per capita incomes under $25,000. So now we know how much people make, but how much does it actually cost to live here? This is an estimation from the Massachusetts Institute of Technology that's established kind of guidelines for what it normally takes to take care of a family. The one adult and one child comes up to about $38,000. The two adults and two children comes to $40,000. So if we have these costs of $38,000 and $40,000, what do we do about the households, the 39,000 that have incomes less than $15,000, and the 70,000 households that have incomes less than $25,000? Poverty is not just different because of geography. It's the different demographic factors also influence it. This is poverty by type of household. As you say, 14% of all families are in poverty. It goes up for a single mother with a child under 18. It goes all the way up to over 42% with a single mother and a child under age 5. This map, I encourage you to go and look at it. It's the poverty by census tracts with council districts overlaid on it. And everything in red is poverty over 20%. Out of 648,000 people, 122,000 are in poverty. And poverty is not much. One person, 11,000, the scale goes up from there, but it's not much. Why do we do this? We want to know what people need. We have two sources that are mentioned up there and many other sources in there. 211 calls to United Way and our grassroots community survey that we've conducted for the last few years. Always, the top two needs come out to be housing and related assistance, which means payment with rent and payment with utilities. Workforce and economic opportunity, that means help finding a job and training. Okay, so we know all this is needed, so what do? We need to do what works. We need to use and find data. We need to track what we do. We need to use practices that are already proven to work. We need to set policies, programs, and services that mirror those, and we need to have a cycle. We don't just set things up and leave them that way. We need to continue evaluating and looking at things. We don't still have rotary phones. We don't still have carbon paper. We need to make sure that we, Metro government, can move on with the times. We already know who's likely to be poor. In addition to the single mothers, it's the people who have less education, minorities, foreign-born people, renters instead of homeowners, and people with disabilities are 2 times more likely to be in poverty than anyone else. So with that, we will turn this over to Julius Witherspoon, who will talk about food and nutrition.
I think I'm okay.
Councilmember Bedney, I thought we would let the social services staff make their presentation, and then we'll have questions.
Again, Julius Witherspoon with Metro Social Services. My 2 areas are food and nutrition and long-term services support, commonly referred to as home and community-based services for seniors and elderly. But talking about food and nutrition, just a few of our key findings is when you look across the state of Tennessee, across the nation, Tennessee ranked 6th among all states with food hardships, meaning that people worry about food, what's happened to their next meal. With 46 million Americans nationwide on food stamps, you can understand why food hardships is one of the leading issues. The second one is food insecurity, meaning simply you do not have enough money to cover the end of the month. You're insecure. You do not have enough money to feed your family. And in Davidson County, that number is higher than it is in Tennessee and the United States as a whole. So Davidson County had some issues related to pockets of food deserts and food poverty. Tennessee, when we talk about seniors, one of our most vulnerable populations, Tennessee ranks 5th from the bottom of seniors facing the threat of hunger. We have many seniors who are dealing with issues of making some difficult decisions whether or not to buy food, medicine, or pay for housing. The Tennessee Commission on Aging and Disability also did a senior study, and senior hunger is their top issue that they will be working on the next 3 to 5 years. The next slide. When we look at hunger in Davidson County, and while we talked about the nation and we've talked about Tennessee and Davidson County, based upon the report from the U.S. Conference of Mayors 27 City Survey, of which Nashville participated, the finding was that 30% of the demand for emergency food assistance went unmet in 2012, which meant that 1/3 almost of all of the emergency assistance went unmet. The big emergency food providers, such as Second Harvest and others, what they ended up doing was reducing the amount of food that they put in boxes, also reducing the number of times people could come and receive those emergency food boxes. That's how they responded to it. The second one was the request for emergency food assistance. At the same time they were reducing, the request went up for the past 4 years. It has increased consistently, the need for emergency food post the Great Recession and even now. The primary causes we found was unemployment, high housing costs, and substance abuse. Those are the issues. Secondly, what are the hunger and needs in Davidson County? When we look at our Women and Infant Children program, there are 30,000 vouchers that are distributed through the Mental Health Department for the Women and Infant Children program, and it is only continuing to grow, and the only cap is the amount of money received from the federal government. One of the largest indicators of public school success is whether or not children are on free and reduced lunch. I don't have to tell you all, 3 out of the 4 Metro Nashville public school students now are receiving free or reduced price lunch. And in Davidson County, our participation of SNAP food stamp is higher than the national average. Lastly, there's a couple of things that do work. What we have found when we looked at our evidence-based practice, what we found is what they call client choice food pantries. And they operate a little different than what you call your traditional food bank site. And the difference is that a food bank site, you receive what they give you. And a client choice pantry is set up very like a little small supermarket, and families are able to go in and choose what they want. That does 2 things. It reduces waste, and it brings some dignity to those people who are seeking emergency food assistance. And lastly, particularly for seniors, what we are looking at, one of the best practices, is what we call medically tailored meals. As we do now, meals are provided as we have them, particularly for our seniors. But now with chronic condition, we're looking at medically tailoring those meals. And so some of those evidence-based practices indicate what we can do to address this growing need. The second piece of mine is one that's near and dear to me, what we call long-term services and support. What we formerly call home and community-based services. 2 things what we found out: either you're going to be a caregiver or you're going to need a caregiver. That's what the statistics shows. So this long-term service is just a continuum of supportive services for persons who have limited capacity either from physical, cognitive, or mental conditions. Some of the key findings that we found in long-term services support: Davidson County senior population will double by 2040. We will have more people aging, a part of the baby boomers. Our biggest issue is in Davidson County is ambulatory difficulty, persons who need long-term services support because of their inability to walk and maneuver themselves and independent living. And persons with those disabilities are likely to have lower incomes. When we talk about the federal poverty level, those persons' income will just not meet what it costs to live in Davidson County. A grassroots survey indicated that homemaker services for elderly and disabled was the greatest need that we found. I don't have to say about that slide. You'll find it in long-term services costs more than it does. That long-term services are much more cost efficient than it is for institutional care. Lastly, two things that we will talk about more in ours is age-friendly communities where districts are a little bit are more senior-friendly. And lastly, with the growing number of seniors, our need to address abuse and neglect and financial exploitation of seniors continues to grow. All of those things and our suggestions are in the community needs evaluation. Thank you so much.
Good afternoon. I'm Joyce Hillman. I am also one of the analysts with the Planning and Coordination Unit. I have the pleasure this afternoon of talking with you about health and human development. I will talk with you briefly, and I have two main points that I'd like to stress. One, when we invest in producing healthy communities, the people in those communities are healthy. And secondly, it is cost effective to invest in every community to make sure that we have safe environments and access to healthy choices. What determines our health, or what affects our health? We can see it's a lot of determinants. And not only is exercise and eating right just as important, but we can see that there is so much more. Okay, in 2013, Davidson County, out of the 95 counties, was 13th in Tennessee for health outcomes. And Davidson County, as you can see, being 13th, being that number one would be the healthiest, did relatively well in health outcomes. That takes in premature deaths and the quality of life. And a lot of that is attributed to the successful programs through the Metro Health Department. A lot of very effective programs that they've been addressing infant mortality, children, and premature deaths. So in health factors, we did not do as well. In Davidson County, as you can see, the health factors, just from the pictures there, we can see that the areas where the county had the most challenges had been in the areas of the physical and built environment. There we were 94th out of 95 counties, almost at the bottom of the scale. One of our many challenges may have been attributed to, and has been attributed to, the fact that all neighborhoods do not have safe places to walk within walking distance of playgrounds. Children don't have places that are safe and that they can walk or ride adults. Also, not all neighborhoods have bike lanes and safe sidewalks and regular access, as well as reliable access to transportation that comes at the different hours when a lot of people have different shifts. Also, access to fresh fruits and vegetables. That's also one of the attributing factors. Also, we did have challenges, as you can see, in the areas of the social and emotional factors as well. We were 67th in that area, and that area consisted of education, jobs, income, and not enough support services to support families that are struggling to make ends meet. And we feel very privileged to be one of those agencies, being Metro Social Services, that we help families to stay together as much as we can and with limited resources. Again, we commend the Metro Health Department as well as other public agencies and nonprofit agencies that have been so effective and have contributed to the health behaviors and the clinical access in keeping those scores relatively stable. So to sum it all up, we know that healthy environment, healthy human development is the foundation of a lifetime of health. It increases our potential for success. It is an essential part of quality early childhood education. It helps people to not only be physically healthy, but mentally healthy and stable as well. And it also reduces the risk of physical and mental disabilities. Finally, in this time of efficiency and effectiveness, it is essential, as we all know, to invest in what works. So healthy people are assets to our community and not liabilities. Quality early childhood education is one of the most cost-effective ways in investing in future success with our students graduating from high school and on to college and on to further success. Families become more stable and productive. Also, we have reduced crime rates. And lastly, but not least, we have a growing and stable vast of taxpayers. Thank you.
All right, I'm going to be very quick because this is a real simple thing. During the housing bust, if you all remember that, home values went down, rents went up, and they're still going up. Part of this is because there's tremendous pressure on the rental market from former homeowners becoming renters. There are a lot of, at least 3 big companies buying up single-family dwellings, properties, and fixing them up a little bit and renting them until the price goes up. The Nashville area, though, has turned the corner, we think. You'll see in 2011, 2012, single-family construction went up. These are building permits. And all family structures, the number of units in all family structures went up. So slowly, we're recovering. The thing that's not recovering is the cost burden of renters and homeowners. Cost burden means that a household is spending more than 30% of their income on housing expenses. Some of them pay 40, some of them pay 50. And as you can see, the trend is for renter cost burden to go up and homeowner house cost burden to go slightly down. Most people, 89.9% of the people walking in social services front door have a need for housing or related assistance. Now, many of them have multiple problems and they have other needs as well, but 90% of them have housing needs. As you can see, one person working a full-time minimum wage job cannot afford a place to live without paying more than 30% of their income for housing. Retail salespeople, childcare worker, housekeepers. As a matter of fact, for the tourist industry, which is so important to us and all the new wonderful things that are going up downtown, they all have to have housekeepers, they have to have wait staff, retail sales clerks. The question I keep asking is, where are these people going to live? We need more bricks and sticks. It's a real simple answer. We need more low-income housing, not necessarily subsidized, but for low-income working families. There are people who, as I said, work a full-time job and really can't afford a place to live. Thank you.
Thank you, and let me share with you a few things about where the jobs are in Davidson County. As we know that the recession ended almost 5 years ago, but the scars it left to many communities, still people feel it. All demographics, especially young people and minorities, are still facing unemployment. But if you look at historically where we were in 1970, come close to the recession in 2005, it was 4.5%. It went up almost 10%, but as of January of 2014, unemployment in Davidson County is 5.3%. However, what you cannot see in those is that what kind of jobs are now available to many of the families that we assist in our department. Mostly work in low-wage occupations, such as cashiers, cooks, personal care aides, home health aide, food prep workers, retail sales, and housekeepers. During the recession, if you look at between 2009 and 2012, most of the jobs that these people work, if you look at the right side, you could see how their real wage went down, especially if you look at number 6, 7, and 8, which are restaurant cooks, personal care aides, and maids. 7%, 5%, that's how much their income has decreased, their wage. So those of us who have been here in Nashville a long time, we remember how the landscape of jobs have changed. Not far from here, when we go to Worth and Packaging, that was 8th Avenue North near Farmers Market. If you look at the other side of the river, Leggett and Platt, Steiner Relief. If you look at Black and Decker, that was a Polk Avenue. Murfreesboro Road, we had Genesco, Mossman Drive. So many families had access to well-paying jobs that were manufacturing jobs. What has replaced those jobs are what we see here, which mostly pay $9 and $10, which cannot allow families to afford to live in a decent and affordable neighborhood. We have jobs that are created now, which we call high-paying, high-demand jobs. But those require bachelor's degree. And if you look at Davidson County, less than 24% of the population has bachelor's degree, including baby boomers that are going to retire soon. So keep that in mind, that majority of our working poor don't have a college degree. And it makes life difficult for them to afford it. Also, many of the low-income families we work with don't have banking relationship here in Davidson County. They go to alternative banking, which is pawn shops and payday loans, which charge a fortune for people just to cash their own checks. So there is a real need in Davidson County to see many low-income families to have access to a banking relationship. With that, we conclude our presentation.
You're on.
Thank you very much for being here. We'll try to answer any questions that you have. If you would like a slightly longer version of this presentation, you should have received an invitation to our April 9th event, Magnitude and Patterning of Nashville's Poverty. We sent the announcement out less than a week ago. We've already had 170 people register for it, but we will find you a seat if you want to come. I guess we'll go along to the questions. Any questions, please?
All right. So just before we get started here, I will call on members of the Health, Hospitals, and Social Services Committee first, and then I will follow with other members that are in attendance. Councilmember Claiborne, you're recognized.
Thank you, Mr. Chair, and thank all of you for being here. This is this book shows a great deal of work on all of your parts, your research and your compilation, and so you're to be commended on the product that you brought to us and all the information. All we need to do is to digest it. But I had a question. The gentleman that made the last presentation, the last thing that you said was about the lower working class needing a banking relationship. Those of us who, in a lot of the districts, there's a proliferation of the instant cash or check cashing or whatever entities. In my district, in a I think about a mile stretch, I have 6, and another is being added. And so the response on that side is we wouldn't be here if there wasn't a market, which is a legitimate answer. But how do we cultivate that banking relationship that you're talking about? What can we do, or as a city, to try to encourage moving in that direction rather than using these places that cost more in the long run?
Thank you for asking. The short answer is it's a very complicated situation. A few years ago, there was the Nashville Poverty Reduction Initiative that was pioneered by Metro Action Commission and the Chamber of Commerce. And there was a committee that addressed economic opportunity, and now United Way is leading that. What we were able to do was, first, we engaged the banks. But people who go to these places, they will give you so many answers that say it's flexible to go to the alternative, it's easier to cash it, you can have access to it as soon as possible. They have so many reasons that they will tell you why. And if you notice, we made a map years ago that shows all these places. They are on Gallatin Road, Charlotte, Murfreesboro, and Nolensville Road. And if you look at each establishment, there is a bank next to it. And you would say, why would someone go here? According to those low-income families, the surveys that we did, they say it's much easier to have transaction with this than others. But there's an initiative called Bank On that was initiated by the mayor's office and United Way. And we engaged banks. It's going to take for a long time. And now we have what we call Financial Empowerment Center, which Eric Cole runs it. And what we're trying to do is that to educate as many people as possible. I mean, one of the other things that's very sad is what we call RAL, people who file income taxes and go some places that charge a fortune. Just they have to take a loan on their income. But we have VITA sites, and most people, because it's convenient for them to go that. So I think the answer is we have to commit into a long-term education and financial literacy that we have to use through nonprofits, schools, and everywhere that we can to educate as many people to do that.
Okay, so are there any kind of programs being considered from an educational point of view to engage the schools, the parent organizations at schools, to try to begin to move in that direction? Yes,
the Bank On initiative, but also we have what we call the Economic Opportunity Committee that's headed by United Way. The schools are engaged, but we would like to start with kindergartners, how to manage resources rather than starting with high schools. But it's a culture change that we have to go through that, and it looks like most people are not embracing the idea at this moment, but it's appealing. I think we will have to work one neighborhood at a time. But yes, there are efforts pioneered by United Way at this moment.
Okay, thank you. If you're working one neighborhood at a time, District 15 is willing to work with you.
Thank you.
Thank you, Councilmember Claiborne. Councilmember Gilmore, you're recognized.
Thank you, Mr. Chair. I would like to thank the social services for giving such a wonderful presentation. Each one of your presentations were very informative and equally delightful and insightful. I had 4 questions, so I'm just going to ask them, and then you can divide them amongst yourselves. One was I wanted to know more about the built environment. It's hard to believe that we're 94 when it ranks to that, and we think about ourselves compared to other counties. So what accounts for that? I know the sidewalks, but it would be interesting in what makes other counties. Maybe I'm just, I don't know, so proud of Nashville. I can't believe that we would be 94. But when we think about other counties and there being 99, wanted to know the difference between that. And the second question was the innovation office. I wanted to see how the data that you have works with the innovation office with Christine Lalonde and how you're overlapping that data to make a difference. The third thing was I recently read an article, I think it was in yesterday's paper, about people with disabilities, and they were talking about how the state has cut back on the money and by cutting back on programs. And I noticed that you said that people with disabilities are in high poverty and it's increased with them over the years. So I just wanted to know how you guys interact with the state, since a lot of the funding, when we talk about SNAP and women's programs and WIC, do you have an advocacy office, or how do you communicate that as it relates to us as a city? And those are my questions, and I look forward to those answers. Thank you.
Okay, first of all, on the built environment, the Robert Woods Johnson's Foundation is the one that does the annual county health rankings and outcomes, the roadmaps. And every year they rate each of the states and break down all the counties. Now, to get all the specifications of the built environment, I will have to give you all of theirs specifically from what they measured, okay? But it does take into account that not every neighborhood has is walkable, where children can walk and ride their bikes. Another important factor is the fact that not every neighborhood has access to fresh fruits and vegetables. And I know we hear a lot about that, but that's a real factor because, again, that impacts our health. So it's so many of those factors that not every neighborhood, we have a lot, and that's why I commend the Metro Health Department, but we don't have enough that every community, and most of those that are probably greater, have the greatest impact are probably the very low neighborhoods. For instance, one neighborhood I can think of, I won't call the area, but there's nowhere to walk without having to pass a major street, a major highway, and to get groceries that are fresh vegetables and fruits. So those factors really have a great determinant on some of those outcomes, but I'll be glad to get all of that back to you and share it with this committee. Thank you.
We will be glad to send you a copy of the PowerPoint. In terms of how we work with the state, they're involved in some of the committees that Abdogani mentioned at some point. We try to inform them. We send out lots of issue papers and newsletters with information, including a lot of people at the state. In terms of we're really not in a position to lobby from our department. But one thing that has happened as a result of some events we've had and the needs evaluation, there's a new organization that began last year called A Voice for the Reduction of Poverty. Avi Poster and Marcia Edwards, who's Martha O'Brien, are the heads of this, and it's kind of outside the government so that they can do lobbying, and they work on state issues, federal issues, and local issues when there are some. In terms of the Office of Innovation, we've been doing the needs evaluation for a number of years. This is the 5th annual, and they're very new. They do have access to the data. We hope that they will use the data. We hope that they will use evidence-based practices. And there's also a section in it about understanding poverty, because the old theories about blaming it on an individual or blaming it on a culture are basically pretty much outdated. There's new research showing about cognitive processing. We do have 2 staff members who provide part-time staff support for the Office of Innovation, Abdogani Bari and Lee Stewart, so they are providing support for them.
Thank you. Councilmember Bedney, you're recognized.
Thank you, Chair. I have a question about how we translate the data to our districts. I'm looking at the map on page 32, and I'm sure it is accurate, but I'm looking at Brentwood showing that it has a 20 to 44% poverty rate. And
I'm sorry, I failed to mention this. In the very back of your book, it has some tables with information, a lot of information broken down by each council district. Mm-hmm. So that may be of help. If you have specific questions, please feel free to email us or let us know. But we basically just took it from the Census Bureau.
Okay, because I remember that we changed our districts a couple of years ago. Mm-hmm. And so I wonder, how did you translate the data?
We got the shape files that are used in mapping from the planning department. And so when they updated a couple of years ago, they gave us the new shape files.
Okay. Well, it's just amazing.
Well, and I didn't mention, because I was only supposed to talk a few minutes, but I talked too long already. But I will tell you that every council district has got at least 500 people in poverty. There's only, District 34 is the only district that has only that few number. Everybody else has more than 1,000. And I'm sorry to say, Council Lady Gilmore's district has over 7,000 people. So they're all over the place.
Yeah, and I've witnessed that, and I think all of us, when we campaign, we get to walk our districts, and it's different than when you get in your car from home and go to work. that you don't get to see the real, the way the district is. And when I campaigned, I was very surprised that there are people in my district that are on fixed income and they live in homes that are falling apart, and that I'm sure it happens all over the city. So I appreciate you reminding us that you know, the people that live in Nashville, how they endure and suffer sometimes in bad conditions. So thank you very much.
Thank you. Councilmember Langster, you're recognized.
Thank you, Mr. Chair. I do appreciate all of you coming down. You supplied an encyclopedia full of information. And if I'm not ahead of Councilmember Gilmore with more people in poverty, I'm very, very close, District 21. And let me say, it is so good to see Mr. Julius Witherspoon. He has been with this issue since I first met him about 30 years ago. He has been supporting children, women, infants, the elderly especially. He sits on a board of directors in my district, 18th Avenue Family Community Enrichment Center, and they cater to children who really need strong support. But my question is, when I talk with people, seniors especially, they're having a most difficult time in deciding whether to have a nutritious meal or to pay NES. Now, how do you address that issues within social services? Thank you.
We have a couple of programs that provide services. We have a nutrition program that serves how many people a month? About 1,000 people a day. We also have a homemaker services program to help people stay in their home and not go to nursing homes. But something I'd like to mention, the census measure of poverty is not really good. It was developed in 1963. So a couple of years ago, well, actually 4 years ago, 2010, the Census Bureau took and analyzed each state to see if they used a different formula that included other resources, like if people get benefits, food stamps or whatever, subsidized housing, includes something besides cash as an income, but also included expenses such as unreimbursed work expenses, co-pays and other medical expenses they had to pay out of pocket. When they did that, they found that the poverty for young people under 18 went up. The poverty for senior citizens went down. But we don't use, we federal government, do not use that for any kind of eligibility. That's just some data they found. And they did this for research. So they're continuing to research it. They can't really figure out who's in poverty.
No, ma'am, I think you missed my question. Okay. When people have to decide if they're going to pay their NES light bill or buy nutritious meals for their dinner, for their lunch, their once a meal day, how do you address that issue in helping them or coping with it? I mean, that's an impossible decision.
It is particularly impossible. For decades, Metro Social Services had a financial assistance component, and as of 2005, that was discontinued. And so in terms of cash money, we don't have any to give people. We do have social workers that work with other agencies that may or may not have money to try to get assistance for them. There's also, we do work in terms of health with some organizations. The Dispensary of Hope provides a lot of prescriptions for people. There are ways to work with pharmaceutical companies to get reduced prices. So there are ways we can do it even without cash, but for almost 10 years we haven't had any cash.
And we're also co-located with Metro Action Commission, so we work very closely with them in helping seniors in paying their NES bill if they qualify for the program. If they don't qualify for the program, as Ms. Gregory stated, we try to find other resources and partners within the community to assist seniors in paying their bills, but it's very little money out there.
Well, what about children in the summertime who are out of school? They don't get that morning breakfast or that lunch meal. what does your agency do with the children?
We don't do anything with summer youth program at all. Metro Action Commission just opened 2 new summer sites last year to feed children, but again, it still is not enough. So we encourage you, if you can have anything to do with that or make recommendations, please do, because it's still never enough food for the children and as well as for the seniors.
How many people do you employ?
We have 89 staff people.
And what is your annual budget?
A little bit over $6 million.
Thank you.
Mm-hmm.
Councilmember Moore, you're recognized.
Thank you. Did I call you chair? No, just kidding. Just kidding. Thank you, Ms. Gregory. And Renee, it's always good to see you. I guess my question is, I know that I'm going with education. I think one of the councilmen before he left, Councilman Claiborne, talked about education as an important key component. The last time I talked to the Nashville Career Advancement Center, they were trying to do something. I know you all were connecting to that as well. What is the push? I mean, with getting people to pursue their degrees so that they can get some of these skilled jobs. I know that Goodwill is always trying to train people with whatever jobs are presented, and as well as other entities around, just like Jump, skills oriented, but they don't have the high school diploma just to get those skilled jobs. So if they don't get the skilled jobs, of course we're going to have poverty. So, what is the push towards, I guess my main concern is just education to get these skilled jobs. And also, I know they just recently, I think as of January, they changed the requirements to get a diploma. They raised not the score up. They didn't have the money for people to try to get their diplomas, which I thought was just unnecessary. So, but what is the push towards education to get these skill set jobs?
Well, thank you for asking that. We have a situation where people who have got beyond high school and know exactly what kind of training they need to take, the Career Center is in a position to help them that. And there are federal resources designated to help people in those. Where we have a challenge is people who are not at that level and have got other issues who would like to complete a high school or finish a GED. There is a gap in the community that doesn't exist to that. So what we try to do is to rely on nonprofits as Goodwill, the Urban League, OIC. Those are the ones that we rely on, and we tell people to be assisted in filling what we call the lower level of the career, not the advanced one. And that's how, unfortunately, things are structured. NCAC, the Career Center, they get federal money, and they are dictated who they can assist with. And in order for them to meet certain performance requirements, they have to train people that have to make certain salaries. So exactly that gap exists in our community when it comes to workforce development. The other thing that assists people is GED. There's no longer metro schools through the adult basic education. They used to do that, but now they don't do that. And it looks like the state decided to award the resources, the place next to Nashville Tech, it's called Tennessee Technology Center. When we look at an estimate is there are about 700 people that are in one way or another enrolled in adult basic education. But there are 73,000 people in Davidson County as of 2013 that don't have a high school diploma. So you can see where the gap is. So it is an unfortunate situation, but what we have currently is the Career Center that assists people who meet certain criteria, but there's a gap in the middle that don't exist to that. So the nonprofits fill that role of helping families at least to obtain what we call soft skills and other things.
Thank you.
Thank you. Councilmember Allen, you're recognized.
Thank you, Mr. Chair. Thank you all for being here and giving us this great information. I have a question about affordable housing. Are there best practices from other cities that we can look at and try to begin to implement here to ensure that some of the new stuff that's being built is good quality but reasonably priced?
Yes, there are best practices all over the country. One that I worked on fairly recently was Affordable Housing Trust Fund, and as you know, we have the new Barnes Fund. We joined over 600 other places in the United States that have a trust fund. There are literally 100 different things that other cities are doing. We've done some research on that. It's available. We can make sure you have it if you want. One of the difficulties is that every place is different. There are, in each of these, mixed income housing, mixing affordable market rate and subsidized in one place. All these things need to be adapted to the locality. That's very specific. We have a kind of a unique situation here in Metro, but they are adaptable, and there's a group, the Barnes Coalition, as a matter of fact, who continues to look at those kinds of things to see how we can bring them here.
Thank you.
Thank you. Are there any other questions? If not, Ms. Pratt, I'd like to thank you and your staff for being with us this evening. I'd also like to thank the members of the committee and the other members of council for spending your time and asking great questions. If there are no further questions, I will call the meeting adjourned. Thank you.